Digitalis glycosides, also known as cardiac glycosides, are medications that have significant effects on the electrical and mechanical properties of the heart. Therefore, to understand digitalis glycosides, it is essential first to grasp the normal electrical and mechanical functions of the heart. Action potentials, or electrical signals, trigger the heart's contraction. These action potentials originate from the sinoatrial node, also known as the SA node, which is considered the heart's natural pacemaker. From the SA node, the action potential travels through the atria, or the two upper chambers of the heart, causing them to contract. Next, the action potential travels through the atrioventricular node, also known as the AV node, where it is briefly delayed before continuing through the bundle of His and Purkinje fibers, ultimately leading to the contraction of the ventricles, or the two lower chambers of the heart. At the cellular level, when an action potential reaches a cell, it causes sodium and calcium ions to enter the cell, while potassium ions exit the cell. The influx of calcium is what triggers the contraction of the cardiac muscle. Once the action potential has passed, the cells must return to their original ionic balance. Sodium-potassium ATPase pumps found on these cells transport 3 sodium ions out of the cell in exchange for 2 potassium ions into the cell, while a sodium-calcium exchanger moves a calcium ion out of the cell in exchange for a sodium ion. This exchange continues until the cell returns to its original ionic balance, ready for the next action potential. Digitalis glycosides affect the ability of cardiac cells to return to their original ionic balance by inhibiting sodium-potassium ATPase pumps. This inhibition leads to an accumulation of sodium inside the cell, which in turn suppresses the sodium-calcium exchanger. As a result, the levels of calcium inside the cell remain elevated. As additional action potentials pass along the cell, intracellular calcium levels continue to increase. As mentioned earlier, calcium plays a crucial role in the contraction of cardiac muscles. Therefore, elevated calcium levels in cardiac cells increase the heart's contractile force, making digitalis glycosides positive inotropes. And this positive inotropic effect increases stroke volume, thereby increasing cardiac output, or the volume of blood the heart pumps per minute. Digitalis glycosides also enhance the activity of the vagus nerve, which is a component of the parasympathetic nervous system, commonly known as the rest and digest system. This action reduces the firing rate of the SA node, resulting in a reduced heart rate, and thus these medications are considered negative chronotropes. Additionally, enhanced vagus nerve activity reduces the conduction velocity of action potentials through the AV node. The most common digitalis glycoside is digoxin. Digitalis glycosides are primarily used as a second-line treatment for symptomatic heart failure in patients who still experience symptoms despite optimal therapy with first-line medications. This type of heart failure is called refractory heart failure. Digitalis glycosides are considered a second-line option because newer medications offer a better safety profile and improve long-term survival. In fact, digitalis glycosides do not have a positive or a negative effect on long-term survival. However, they may help reduce the need for hospitalization. Digitalis glycosides are also used to help control supraventricular dysrhythmias, or dysrhythmias originating above the ventricles, such as atrial fibrillation, atrial flutter, and paroxysmal supraventricular tachycardia. Adverse effects of digitalis glycosides include bradycardia, nausea, diarrhea, headaches, dizziness, fatigue, and mild visual disturbances, such as blurred vision. Digitalis glycosides should not be used with uncontrolled ventricular dysrhythmias and second or third degree AV block without a pacemaker. Before administering a digitalis glycoside, it is essential to measure the apical heart rate for 1 full minute. If the heart rate is less than 60 beats per minute in an adult, the dose should be withheld and the MRP should be notified. This is necessary due to the medication's negative chronotropic effect, which can lead to a dangerously low heart rate. Similarly, if a change is noted in the rate, rhythm, or quality of the pulse, MRP should be notified. Additionally, it is crucial to assess intake and output, weight, and edema, and to auscultate the lungs. This assessment will help determine the response to treatment in patients with heart failure. While on a Digitalis glycoside, routine blood work is essential. This includes serum digoxin levels, as well as potassium, magnesium, calcium, and a renal panel to monitor for and prevent toxicity. Digoxin has a narrow therapeutic range, ranging from 0.5 to 2 nanograms per milliliter. However, for patients being treated for heart failure, a narrower target of 0.5 to 0.9 nanograms per milliliter is recommended, as higher levels may increase the risk of toxicity without providing additional benefits. Typically, serum digoxin should be drawn 6 to 8 hours after the last oral dose. Potassium competes with Digitalis glycosides for binding at sodium-potassium ATPase pumps. Therefore, high serum potassium levels, or hyperkalemia, increase the competition for binding, which can decrease the therapeutic response of Digitalis glycosides, whereas low serum potassium levels, or hypokalemia, decrease the competition for binding, which can increase the therapeutic response of Digitalis glycosides and increase the risk of toxicity. The goal of serum potassium while on a Digitalis glycoside is generally 4 to 4.5 milliequivalents per liter. Magnesium plays a crucial role in stabilizing cardiac muscles. Low magnesium levels, known as hypomagnesemia, can increase the heart's sensitivity to Digitalis glycosides, even while serum digoxin levels are within therapeutic range. Moreover, hypomagnesemia can exacerbate hypokalemia and make it refractory to treatment, further increasing the risk of toxicity. Calcium is important because high calcium levels, or hypercalcemia, can enhance the effects of Digitalis glycosides, thereby increasing the risk of toxicity. And a renal panel is important since digoxin in particular is primarily excreted through the kidneys. Therefore, impairment in kidney function can diminish the clearance of digoxin, increasing the risk of toxicity. Digitalis glycoside toxicity can be life-threatening and may present either acutely or chronically. Signs and symptoms include the previously mentioned adverse effects, in addition to severe dysrhythmias such as profound bradycardia, AV block, and ventricular tachycardia, syncope or fainting, xanthopsia or yellow-tinted vision, chloropsia or green-tinted vision, confusion, and hallucinations. Digitalis glycoside toxicity is diagnosed based on signs and symptoms, blood work, and an ECG to detect dysrhythmias. It is essential to note that toxicity can still occur even while serum Digitalis glycoside levels are within therapeutic range. Treatment of Digitalis glycoside toxicity includes stopping the medication and correcting electrolyte imbalances. If bradyarrhythmias are severe, atropine or temporary pacing may be necessary. If the medication was ingested recently, activated charcoal can be administered to limit absorption. However, gastric lavage should be avoided as it may increase vagal tone and worsen bradycardia. In cases of severe toxicity, the antidote, Digibind, may be given. Digitalis glycosides have many drug interactions. Therefore, it is crucial to consult a healthcare professional before taking any medications, including prescription drugs, over-the-counter products, and herbal supplements. Many medications can increase serum Digitalis glycoside levels. Some of these include non-dihydropyridine calcium channel blockers, such as verapamil and diltiazem, as well as tetracyclines, such as doxycycline. On the other hand, there are many medications that can decrease serum Digitalis glycoside levels. These include bile acid sequestrants, such as cholestyramine, thyroid hormones, such as levothyroxine, fiber supplements, or high-fiber meals, when taken within 1 to 2 hours of a Digitalis glycoside, and St. John's wort. Additionally, many medications can affect electrolyte levels, increasing the risk of toxicity. These include diuretics, such as loop and thiazide diuretics, and corticosteroids, such as prednisone. Furthermore, many medications can, when taken with a Digitalis glycoside, increase the risk of bradycardia. These include beta blockers, such as carvedilol, non-dihydropyridine calcium channel blockers, such as verapamil and diltiazem, and alpha-2 adrenergic agonists, such as clonidine. I hope you found this video helpful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you! and bye!